Hi and welcome to Pelvic Exercises. I'm Michelle Kenway. Today I'm going to be teaching you how to perform pelvic floor muscle exercises or Kegel exercises following gynecological surgery, whether that be hysterectomy or whether it be surgery for a prolapse repair or for incontinence issues that you may have been having. You will have probably been told how important it is to have your pelvic floor muscles strong and supportive to support your insides long term and support your surgical repair. Remember that it's very important that you have your gynecologist's approval before starting these exercises, and different gynecologists will have different time frames for when they're happy for you to start your exercises. So make sure that you check with your gynecologist before you start these exercises. The other important thing is to remember that all your exercises should be pain-free. You shouldn't feel any pain or discomfort through your vagina or through your abdominal area, both during your exercises and when you finish your exercises. So important things to remember there. Now, remember that your pelvic floor muscles are inside your pelvis. I've talked to you previously about where to find and feel those muscles. If you're not sure where to find and feel those muscles, please send me an email at pelvicexercises.com.au and I'll send you a free 10-minute video on how to find and feel those muscles working, so that you know that you're actually lifting your muscles inside and not pushing down. It's vital that you're not doing the wrong action, pushing down through your pelvic floor, which is the wrong action and can actually cause damage to your pelvic floor, which is exactly what you don't want following gynecological surgery. So make sure that you know how to activate those pelvic floor muscles correctly and email me at pelvicexercises.com.au if you're not sure and you'd like that video. Alright, so what action are we after? We're after a lift and squeeze action, lifting and squeezing through our back passage, drawing up through your vagina and tightening in and around the urethra. Remember that your urethra is where the urine comes out, so your urine tube. So it's that action happening inside. When you start your exercises, they need to be gentle, they need to be slow, they need to be controlled, and they need to be pain-free. So let's get started. You can perform these initially lying down, either on your side or on your back. Today I'm going to perform these for you lying on my side so that you can see what I'm doing. Not that you'll see a lot from the outside, but I'll be able to talk to you and you'll get the general idea of what I'm doing. So let's come down into lying. Alright, so I'm checking that my position is nice and supported. I've got a lovely inward curve in my back, which allows my pelvic floor muscles to work best, and my body is nice and comfortably supported. We're going to start by trying to develop a very gentle tension through your back passage. So it's going to be that type of an action, as if you're trying to stop wind in a public place that you don't want to let go, and you've got to draw up through your back passage, not by squeezing your buttocks, by actually lifting the muscles inside, in and around your anus, inside that rectum. Okay, so let's try and lift up inside through that anal area, through your back passage, draw it up and in, lift it gently and slowly relax it down. Could you feel a gentle lifting and tightening sensation in that area and a relaxing down? That's the feeling that you're after in that area. Now let's move forward a little bit through to your vagina. And to help you to feel this, you can very gently use your hand over your clothes, over the outside part of your vagina, and rest it very comfortably there to ensure that you're getting a lifting away from your hand, not a pushing down sensation against your hand. You're after a lifting away sensation. So once again, we're going to try and draw up, squeeze and lift inside your vagina. Are you ready? And try and lift up inside and breathe and lift and breathe and slowly, slowly relax down. Could you feel that area lifting up inside? You might have felt the back passage tightening and lifting as well at the same time and relaxing down. Now, we're going to try and also visualise and contract in and around that urethra, in and around your front passage where the urine comes out. So we're going to try and get all three pelvic openings lifting and squeezing, contracting together. Ready? And go. Lift and squeeze and keep breathing, keep lifting. And slowly relax and fully relax your muscles. Let them return right back to their resting position. Fully relax, nice deep breath in and out, and let the muscles relax before your next attempt. When you start to practice these exercises, it's very important that not only that you get a really good lift, but that you get a full relaxation of the muscles, so right back to their resting length, and good recovery time, whether that be 15 to 30 seconds to allow the muscles to fully relax and recover before your next attempt. So we've just started to do 3 or 4 repetitions there, gently contracting and down, and that's more than enough for today. Remember, I said to you at the outset that you could also be performing these exercises lying on your back. So you could be using your lying down bent knee position, or even legs straight, whatever feels most comfortable for you at the moment following your surgery. Okay, so coming up, by coming onto your side and lifting up safely, let's talk about what we've done today. We've talked about, first of all, the importance of getting your gynecologist's approval for doing pelvic floor exercises following your surgery. And we've also discussed the importance of making sure that your exercises are pain-free, both during and after you're performing those exercises. You can gradually increase the number of exercises that you do. You might start on the first day doing 2 or 3 exercises, as we've done there, and then over the coming weeks, gradually increase the number of repetitions that you're doing, and also increasing how long you're holding those muscles for, up to 10-second holds. You'd also very, very gradually increase the strength of those contractions as well. So there's a number of ways of progressing the strength and control of those exercises over the coming months. So that's it from me today. I've enjoyed exercising with you and demonstrating how to do those, how to start your pelvic floor exercises following your surgery. Here's to your healthy recovery and a healthy pelvic floor. Bye from me today.